I am going to demonstrate two projections. First is the AP oblique projection, right or left position for the atlanto-occipital joint, and then the AP projection, Fuchs method, for the dens or odontoid process. The IR size to be used for these projections is 8 by 10 inches or 18 by 24 centimeter. Of the patient. Place the patient in a supine position. Then, center the mid-sagittal plane of the body to the midline of the grid and adjust the shoulders to lie in the same horizontal plane. Place a support under the knee for patient's comfort. Of part. So, imagine that the IR is placed inside the bucket tray. So, and then adjust the patient's head so that the midpoint of the IR is 1 inch or 2.5 centimeter lateral to the midline of the sagittal plane at the level of the EMA or external auditory meatus. And then rotate the head 45 to 60 degrees away from the side being examined. So, adjust the flexion of the neck so to place the infraorbital line perpendicular to the IR. The central ray is perpendicular to the midpoint of the IR. It enters 1 inch anterior to the external auditory meatus and emerges at the atlanto-occipital articulation. So, Fuchs has recommended the AP projection for the demonstration of the dens when upper half is not clearly shown in the open mouth position. This patient position must not be attempted when fracture or degenerative disease of the upper cervical region is suspected. Position of the patient. So first, place the patient in the supine position. Center the mid-sagittal plane of the body to the midline of the grid. So, imagine this is the grid here. And then, place the arms alongside of the body and adjust the shoulder in the same horizontal plane. So, and then, place a support under the knee for patient's comfort. So, position of part. So, imagine that the IR is placed inside the bucket tray. And then, center the IR to the level of the mastoid process. And then, extend the chin until the chin and the tip of the mastoid process are vertical. Adjust the patient head to the mid-sagittal plane, and then the mid-sagittal plane is perpendicular to the plane of the grid. Central ray is perpendicular to the midpoint of the IR. It enters to the neck on the mid-sagittal plane, just distal to the tip of the chin. So, here the central ray enters here.